So if folks can be mindful that we are recording this for others to watch later. A reminder again to please mute yourself when you're not speaking. Please use the chat box. In addition to introducing yourselves, we also invite folks to share questions. We'll be monitoring questions throughout the conversation, and certainly we'll have time for questions at the end. In addition, when Dr. Linston starts her time, you can hover on her video. She has it going right now, and in the upper right-hand corner of her image, you can actually pin or spotlight her image as she's moving through her session. So feel free to do that if you prefer. So a little bit of background on the Healthiest State convenings. The purpose is really to provide a platform for statewide partners to engage in shared action and shared planning around advancing health equity in our state. The effort is really focusing on networks and coalitions and multi-stakeholder partnerships. And it's not focused on any particular health issue, but really thinking about health equity broadly, wanting to convene and support diverse leaders to set shared priorities and also catalyze our statewide efforts. In addition to sort of convening and aligning, we are also wanting to offer a capacity building function and skill building around those cross-cutting needs that you as public health leaders need in any issue you're undertaking to really incorporate a health equity perspective across the wide range of initiatives folks are taking. In addition, we want to advance a shared narrative of the things that shape health and equity. We know that no single issue can sort of advance a shared backdrop narrative alone. So working across all the issues that are important to us, having a cohesive way where creating support for health and equity wherever you are and whatever you're working on is a part of the goal, as well as creating a united front while we build partnerships with our elected officials and policymakers. So both the smaller convening, which I'll talk about in a second, and the summit all create space for us as a public health and health community to really build ongoing partnerships with policymakers. The Healthiest State convening is a 2-year cycle. So in odd years, we have a more targeted agenda setting conversation, which is where our health equity priorities came from, and I'll share those in a second. And in even years, which is this year, a larger summit will be hosted, which we're doing this September to provide training and further skill building to support coalitions working on wanting to incorporate a health equity perspective in their work. Our initial audience, this is a brand new initiative, is really focusing on those that already identify as public health leaders and practitioners. We hope that we can expand this audience after the first couple of rounds, but we really want to galvanize and organize our public health community in our state first so that we can increase our cohesion and our impact, as well as be good partners to other equity movement spaces in our state. I referenced the priorities that were identified at the 2017 agenda setting conversation. They are listed here. They include centering leadership of those most impacted by inequity, building diverse alliances and partnerships, declaring racism a public health emergency, developing a health equity narrative, developing a health equity policy platform or agenda, and also to identify and support public health champions around health equity. All of these concepts have had either work groups or will be featured in the upcoming summit. And the work that you will hear today that Dr. Linston will share with us is a part of one of those priorities, which is the Declaring Racism a Public Health Emergency. We've been collaborating with the leaders at the Wisconsin Public Health Association, the Racial Equity Work Groups, which drafted the 2018 resolution on racism as a public health crisis, and that was passed unanimously in May at the conference of membership. And we've been working alongside that work group to support their leadership, as well as to bring additional training such as the webinar today and what will happen at the action space at the summit. And we're working with partners to create a web-based racism as a public health crisis sign-on to really allow to spread the work that the Racial Equity Work Group has started even further across organizations. So look out for the sign-on document, a web-based document, as well as with guidance closer to the summit time. With that, I will hand it off to Dr. Linstons. We're super excited to have her join us both during this webinar and at the summit. Dr. Linstons is the founder of Ubuntu Research and Evaluation, and it's a space to hold Black women's leadership in living, learning, and loving towards the beloved community for Black people in the world. We're excited for her to share her expertise with us today and in the future. So with that, I'll hand it over.
Thank you, Paula. Good afternoon, everyone. It's so exciting to see so many people that I've had a chance to work with over the last couple of years. So hi to all of those familiar spaces, and hello again also to new faces. I am honored that Wisconsin Public Health Association has reached out to Ubuntu to be a part of this very, very important conversation about understanding racism as a public health issue. I will be completely transparent. I was creating the outline for our agenda for the webinar, and I realized every point that I had could go for an hour in and of itself. So I'm going to try to talk about what it is we have here on the agenda for about 45 minutes or so, and then we'll open it up for Q&A. As I'm talking and things come to mind, if questions, comments, concerns come up, feel free to add that in the chat box, and if I can answer them immediately, I'll be sure to chime in. Otherwise, Paula will be keeping track and we'll talk about them towards the end of the session. Paula, could you go to the next slide? Our objectives today are to make connections between racism and public health agendas, understanding what racism is, how racism works, and what its imperative is when we talk about public health. Learn a little bit about the Racism Declaration Action Space, as Paula referred to, what that work has been for the Racism Declaration Work Group, give you a little bit of an overview on what we'll be doing at the Healthiest State Summit, and then have an opportunity for you to connect with colleagues about what is this issue, how do we understand it, and what is our accountability towards working towards this issue. Next slide, please. I real quick wanted to talk a little bit about Ubuntu Research and Evaluation. As Paula said, I am the founder of that organization. We are a learning organization, and we prioritize Black women's voice in leadership. We consult with organizations that strategize towards equity, justice, liberation, and what we refer to as a freedom as yet unknown. So we're very clear about equity and what work we need to do in terms of leveling the playing field and understanding the role of power. And we talk a little bit about justice and how do we account ourselves for things that have happened in the past. What does it look like to free ourselves from oppression? And then there's a space that we have not even conceived yet together of understanding what it means to not have to deal with race, not have to deal with gender, not have to deal with homophobia, not have to do with the inability for us to understand queer identities. We can eliminate all of that and one day be in this place of freedom as yet unknown. But our work brings us to public health often. I am a trained doula, and our team definitely feels very passionate about this work. We do a lot of work with reproductive justice organizing, understanding reproductive justice issues, and we really, really are loving a quote by Milwaukee's new health commissioner, Dr. Jeanette Kowalik. She stated, "Public health is about prevention, not reaction." And I think embracing that quote as we talk about public health as an emergency, an imperative, something that we have to put some action on, really resides within understanding that this is about prevention, not reaction. So we have to treat this product as such. And again, if you want to tag us on social media, you can use the hashtag Ubuntu Research. We're on Twitter, Instagram, and Facebook. What we know is that the American Public Health Association states that public health is about the protection and promotion of healthy people and healthy communities. We know that the sentiment is real for us and that we feel really attached to that. We know that there are barriers within that, and that's what we're going to talk about today, this idea of race being a barrier to the healthy promotion, healthy communities and the promotion of health within communities. I also want to let us know, just keep in mind, like, this context is not just in the air. It's something that's very tangible and very real. So we're in September, which is Infant Mortality Awareness Month, and we're in Wisconsin, in which we know that the infant mortality rates for Black women are 3 times that for white women. And our common logic, which we talk about a lot, the common logic and common rhetoric that's used is that Blackness, or this label of race, becomes the thing that are preventing people from having the healthy birth outcomes or the positive health outcomes that we're looking for. But we're going to talk about it's not race, it's racism. Okay, race does not cause things to happen. It's the system of racism that perpetuates, that marginalizes, that defines people, individuals, communities, institutions as unable or unwilling to be better than they are because of the system of racism. So being very clear that the issue at hand is racism, not race. A lot of times, and I've been accused of it before, the people who talk about race are the ones who are called racists. Oh, you brought up the idea of race, therefore you must be a racist. And that's not how this works. We're talking about the system that allows things to persist that we're really having an issue with. And lastly, I just want us to acknowledge that this whole conversation is about us not being scared. We cannot be scared anymore. We cannot marginalize race to some other group, some other entity, some other idea that's like secondary to what's going on. We have to bring it front and center, because if we're not addressing race, we're allowing it to be pervasive in our communities. And if we can't talk about the health of the community, if we're allowing certain diseases such as racism to persist. Okay, so that's kind of our big picture framework for today, is like it's racism, not race, and that we cannot be shy in talking about the effects of racism in our work and in our lives. Next slide. So just giving a brief overview, I know many people have heard ways in talking about racism and framing around racism, but I just wanted to give a context of what constitutes racism that we can use in our dialogue about public health. One, I want to make sure that we understand that racism is not about preferences. It's not about what I prefer to be around, the people that I like, the people that I know, the fact that I enjoy this and don't enjoy that. That is not racism. Racism is not just an attitude, as in that person has an attitude towards something and therefore that defines racism. Racism is not, like I said before, just talking about race. And racism is not about intentionality, which it's very important that we bring those to the forefront, because often we center those ideas about race and racism as opposed to the actual system that we'll talk about. When we center preferences, when we center attitudes, when we center talking about race, and when we center intentionality, we put racism in this box that is other people's problem. As long as that's not my preference, as long as I don't hold the attitude, as long as I don't talk about it, and as long as I don't have an overt racist intention, I'm not a problem, and racism is not an issue. And that ideology is what gets us trapped a lot. The fact that we connect racism with those ideas. So we're stressing here that racism is not preferences. It's not just an attitude. It's not just the fact that you talked about race, and it's not just an explicit intention. And the explicit intention, reflecting on some of the things that have been in our news media over the last few weeks, it's not just the person who says, I don't like that person because they're Black, or I don't talk to that person because they're brown. That's not the quintessential understanding of racism. That is an effect. That is one part of it, but we have to go deeper if we're going to understand the system. So here on the screen, we have this quick diagram of 3 components that help us understand racism. And I want to be clear too, this, what you're seeing is just a form of the oppression equation. And if we could take racism out and put sexism, and the same things will be true. There's preconceptions, powers, and privileges that create a system of oppression. Racism itself is the systemic denial of human dignity because of their proximity to whiteness. It's this idea that because of color or whatever has been deemed as close to whiteness, that you should not be treated, or you are not worthy of the same sort of treatment as someone who is white. That systemic denial of human dignity is more than just something that I said. It's more than just, I don't like your attitude. It's a whole system of interactions. What's important to understand is those preferences and attitudes that people have, though they are not racism in and of itself, they are backed up by the system of racism, and that's what makes those preferences and attitudes actually powerful. So first, we want to talk about preconceptions. In some places, you'll probably see this as prejudices, and I wanted to say preconceptions because preconceptions are beliefs about something. A lot of times our prejudice, there's some evaluative criteria that we created, but preconceptions are just, we believe this to be true, and so we leave it out there and we don't challenge it, and that just is what it is. So there are preconceptions that people, individuals, communities, and systems have about race that continue to persist in our health environments. I know when I was working with some nursing students, this was maybe about 4 or 5 years ago. I'm a Black woman, and I was sitting in a room with nursing students who were getting exposed to the ideas of race and public health. And we were watching a video, it was Tim Wise speaking, and one of the students starts crying. And the student turns and says, you know, I am one of these people. I am someone who has treated a Black person differently than a white person because I just felt that was something that I could do. And so I'm sitting here as a Black woman intaking a student, someone who's supposed to be learning from me, her explicit preconception of what Blackness is or what Blackness does and how she has actually exercised something because of her preconceptions. And that gets into the power part. She has actually exercised her attitude and prevented someone who could have been my father, could have been my brother, could have been my mother, could have been me, right, has exercised her attitude in such a way that has actually prevented that person from getting the health care that they deserve. So preconceptions are, you know, these ideas and these are beliefs. And I'm saying beliefs because beliefs are pretty strong. We have an attitude towards something and we just kind of stick with it and we actually believe it to be true. And it's so deep within us that we don't even have to speak it. We just kind of act it out in how we interact with the world. Second are powers. Powers are the ability to do. Very simply, being able to act within one's own interest. And when you're talking about the system of racism, what's prioritized is someone's proximity to whiteness. And so in racism, when you have the power to act towards the proximity of whiteness, you are enacting racism. Because you have that power to act in your own interest, because it's close to whiteness, then you are enacting the powers of racism. Whether it's maybe I'm light-skinned, whether it's whatever's been associated with whiteness, and that's a whole nother conversation about the shaping of whiteness and how the idea of whiteness has been developed over time. But every time we exercise something like that, we are pushing towards that idea of power, racist power. And this is important to understand. Power is the ability to act within one's own interest, is because, like I said before, racism is that systemic denial of human dignity. If we are actually in a place where we are dignifying one another, then the power that each individual enacts is the good of the individual for the community that they're in. The problem is when we have those disconnects, which we'll talk about in a little bit, people are enacting power within their own interests, and they're really oppressive systems that they're enacting because of that power. And just a mention here too, this makes me think a little bit about what the struggle is with power. Frederick Douglass let us know, his famous quote is, "Power concedes nothing without a demand. It never did and it never will. Find out just what any people will quietly submit to, and you have found out exact measure of injustice and wrong which will be imposed upon them." So thinking about power as being the willingness to participate in a racist system, because we rather continue participating instead of checking in and saying, yo, I really have to do something about the way I'm enacting racist power, even if it's unintentional. So that's the work that we have to do with powers. And then lastly, we have privileges. Now, I know there's been a lot of conversation about white privilege, and we're used to kind of hearing what white privilege is, and it's this idea that, you know, because I'm white, I have certain benefits because of my whiteness. But I think it's important for us to also understand it as pathologies, right? Because there's Tim Wise, if you have a chance to look on YouTube, has a segment on the pathology of white privilege and understanding the pathologies that are working within that. The idea that we are thinking about my whiteness as something that I can gain access to is, there's a pathology that's wrapped up in there that's anti-Black, right? That's anti-Black, that's saying that if my whiteness grants me privilege, there is something that denies me privilege, and that is Blackness. And if Blackness is something that I'm saying is not going to allow me to succeed, I'm continually backing myself away from Blackness or not being associated to Blackness, even if I am Black, that's a part of this anti-Blackness, which is within this part of racism too. So I know we talk about privileges, and white privilege has gotten a lot of notoriety, and people are able to use that language. But if we leave it there, I think that privilege, or talking about white privilege, has gotten kind of acceptable and kind of like, I got this privilege and got to make sure I check it. And it's like, no, we have to understand that enacting that privilege is understanding that we have created a pathology that is anti-Black and pro-white, and that's what my privilege is wrapped in. If we don't start using some of that language that really talks about the depth of racism, we're kind of ignoring what the issue is here. These three things, preconceptions, powers, privileges / pathologies, have significant implications for public health, right? So we're thinking about racism as a barrier to human dignity, which is our fullest expression of our individual and collective sense of worth. How an individual understands themselves as worthy and valuable within the community has everything to do with how an individual understands their health, their contributions to their own health, and how we understand the system of public health as a whole. Next slide. So here, we're not going to talk about all of this, but I did want to talk a little bit about the connection of racism to public health outcomes. And so racism is to public health as cancer is to cells. And what you see here, I know many of you who have sat in previous workshops with me have seen this diagram before, but this comes from my research around understanding human dignity, and in particular, as it deals with race. And so we're talking about a sense of dignity in that circle. If you think about that word dignity, you can put yourself in that center, right? Each of us has a sense of dignity that's full of those ideas. Our sense of dignity is about our ability to be self-determining, our idea to see ourselves as noble, our idea to sense our own humanity, our ability to have relationships, our ability to be excellent, our ability to have an identity that's respected, to have access what we need to flourish within the community, and merit to be recognized for the work that I'm doing. That is every single one of us. Every single one of us is moving around in that sphere. In addition, as each individual has their own sphere, we have collective spheres that we share. So there's this sense of dignity that I have as an individual that's also shared amongst the collective and the communities that I'm a part of. So we're not healthy, just like talking about the healthy cell concept, if our cells, the parts of our own sense of dignity are actually prevented from flourishing because of systems such as racism. So like public health ain't healthy unless we prevent racism, and then we actually promote what racism prevents, which is Black life, which I think is also one of the challenges that we have to address as a public health field. Like, we have to prevent racism and promote Black life. Like, we have to do those things in tandem if we're talking about actually doing this with a public health framework in mind. We can't do part of it and say we're all about prevention here, but even though promotion is what we said that's a part of public health, we're not going to talk about the other side of what we're preventing. And that becomes one of the challenges that we have to address too in our work. The direct implications to our health outcomes are clear. This is challenged when we think about our own ideas of race, as we said before, preconceptions, powers, privileges, and pathologies, getting in the way of anybody's access to a healthy environment, whether it's as individuals where they're living, whether it's they're a part of a larger community, whether it's how they're understood as an individual in terms of dealing with disease and sickness and promotion of their own health. All of these things, racism is mitigating how those things are working. This is just something that comes to mind too. research study after research study comes out that says, implicit bias is real. We have been mistreating people of color for a long time. Medical students think that Black people can take pain more. And it's like, these things are true, right? These things have happened. You have evidence. But you could have been told this, right, by people of color who would have said, we don't need a research study to tell you that. I can tell you by my own lived experience that this is what is happening. And that's the other side of our issue of like preventing racism and promoting Black life, is like being able to be in a position in which we can talk about what people have known, what people have validated, what people have already expressed, and then saying we're waiting for this other external scientific community to validate what they've told us, what they've already provided evidence for, what they've already been fighting for. And just to circle back, I also want to include like the reason we're talking about race and Blackness is like there is a whole lot of different racial identities in there. And it's not like, oh, this is a white and Black issue. What this is understanding that whiteness and proximity to whiteness is really what's fueling racism. And then Blackness and proximity to Blackness is also what's fueling racism. So if we're not talking about those identities shaping how racist attitudes, racist actions, racist systems are working, then we're missing the mark here. So it's not denying the fact that there's a range of identities. It's really putting front and center the fact that we have these two competing ideas that are happening, and that racism says proximity here is good and proximity here is bad. Some things that we want to think about as we consider racism as a part of a public health crisis. Racism limits who's considered worthy of being part of public, right? So if we're fighting for public health or doing public health advocacy, and we realize there's a term Pauline Littman uses called spatialized exclusionary citizenship, where there's the idea that if you don't live within a certain area, you're not considered a part of the city, the county, or the state. And so thinking about the ways, particularly in the hyper segregation that happens in Milwaukee and the rest of the state as well, that if people of color are marginalized in such a way that they're not even seen or understood as a part of the public. So we have to understand that racism limits who's considered as worthy of being a part of the public. If we're talking about public health and issues of public health, and we're talking about cities that are 40% African American, we're talking about towns in which infant mortality rates vary drastically for people of color, then we're talking about the fact that the public health issues have to reside around the actual public health, right? So we can't marginalize and say, oh, it's a public health issue, and it's just really what these people who we've deemed important or worthy enough to care about are the public, and everyone else who's in the same area just isn't a concern. So that's one of the things we have to be careful of. We also have to think about the promotion of healthy communities, because if it's based on the racist policies that have shaped these communities, then public health is really putting, like we say often in social justice and race work, putting Band-Aids on a much, much bigger issue. So if racism as a system has created communities in certain ways, then we can't come in as public health professionals and treat those communities as they are without thinking about how the system has created those communities. And again, if we don't put that question in the forefront, we can fall into that trap of considering race instead of racism. So if we, as public health professionals, look at communities of color, for example, with the infant mortality rates of Black women in Milwaukee, if you don't think about racism systemically, you start thinking about, well, what's wrong with Black women? What traits are following Black people that define what's going on? How come, what are Black people doing? That's the pathology that starts happening. But if we understand racism as a system, then you back up a little bit and you say, well, what does it mean for Black women to exist in society? How do those things contribute to the overall health of Black women? And then how can we see how that's having an impact on birth outcomes? So it's making sure that we understand the right questions if we're actually going to propose innovative and new ideas, because otherwise we're actually becoming more of the problem if we don't focus on how racism as a system has helped shape the issues that we're engaging. And then racism limits my proximity to health if I'm born into a community or environment that has already labeled my existence. box that has already said, because of this is your race, or this is your race and gender, that you've already been put in a box and you are not able to escape that box. We're limiting ourselves and our ability to think critically about what public health actually should be addressing. So this that we're looking at on our chart is, if we're looking at the ways in which race really prevents me from seeing myself as self-determining, me from seeing myself as noble and worthy, me from seeing myself as a full human being, and then as it relates to the collective, it prevents me having healthy relationships, it prevents me seeing myself as great, it prevents me from understanding my identity as not problematic, but as something that is a part of just how I show up. It's a part of my humanity, that I don't have access to what it means to thrive and flourish within a community, and that I'm not being recognized for the work that I'm doing. We're letting racism dictate how we do our public health work without actually doing the prevention of racism in order to create the world that we want to see. So we don't want to fall into that trap where we're not addressing the ways in which racism, not race, prevent individuals from living their lives fully. And so the public health challenge there is really to move forward in that idea. Next slide. So this here is a fractal. And if you are familiar with fractals, fractals are this idea that what is very small continually repeats until it's part of a large, complex system. And so we're talking about, and we'll really get deeper into this in our action space where we're doing more activities and not just talking. Talking about, what can we do in our organizations and institutions. And I brought this quote here. If you haven't read Emergent Strategy, it's my recommended read to everyone I come in contact with. But Adrienne Marie Brown says, what we practice at the small scale sets the patterns for the whole system. And so it's not a matter of us saying, like, what grandiose policies can we do in order to make everybody get in line. Though we have to do that work, it's really about what can I do, one, in my own individual life and practice, two, in my family or close networks practice and living, and then at the organizational, institutional level where I actually have some influence. How can I begin to set patterns there regarding preventing racism and promoting Black life that allows me to actually make a difference here? Because of the connection between racism and public health, we have to think of ourselves as individuals who are engaging the system, who are promoting the system, who are really making a case for why the system works the way it does, right? Because if we go to work every day, we kind of validate that this system should exist. If we promote a program, we're kind of validating the system should exist, but we really need to be thinking about how the small relates to the large. I'm sorry if the slide went away. So we're looking at, the small creating this large complex pattern. And that is being able to think about the individual to the collective. How am I feeling, acting, and doing, and how that relates to the whole system. So we looked at system, the system of racism as having those three parts: power, privileges, pathologies, and what did I say? Sorry. Oh, preconceptions. Sorry, I had a brain there. But thinking about those three things working in the system of racism, we also have to think about the four different ways we can interrupt, disrupt, stop, prevent, and promote Black life. And we'll get a little bit more into what that journey is for individuals and organizations and what it looks like. But that's around four main things. We're thinking about ideas, we're thinking about institutions, we're thinking about how we relate to one another, and we're also thinking about ideas that we've internalized, right? So we have internalized ideas about racism that are so deep and so complex that we won't even know to question them because we've already made them a part of our lives. And that's everything from how we dress to certain colloquialisms that we share to how we watch TV, how people say things. And I've heard this said before, like, I just don't think Black people are funny, or I just don't, I just don't, like, those ideas about how you can marginalize certain folks or place this identity based upon race on them has everything to do with the system of racism and how we show up in our public health spaces. And so when we're thinking about our health outcomes and we're thinking about our individuals as a part of the community and who we're trying to serve, we can't ignore that the relationships that people have with the world around them has everything to do with their own sense of health, right? So if I'm in a place, in an environment that's constantly demeaning me, constantly telling me that I'm not worthy, or that I am not significant, or that I don't deserve to be here, then that makes it difficult for me to thrive. And if I don't treat that as a health issue, just like my nutrition, just like the water I drink, just like the air I breathe, then we're really recreating a circumstance in which racism, again, as a pathology, is pervasive. And we allow it to be pervasive because we don't disrupt, we don't interrupt, and we don't talk about it on all the levels in which it works. So that's the small to the big. It's me and you, how we relate. It's how I see myself, and it's how I go to work. So there's no way for me to separate the work that I'm doing and say this is about my job. I fulfilled my job and I advocated there, and that's it. And as long as I've done that, I've really recreated it. But I don't disrupt it or interrupt it when I hear racism being promoted at the dinner table, when I see racism being allowed at the grocery store. If I allow those things to continue to exist, I'm ignoring the fact that those instances are just as palpable to the public health issue of racism as the program that I'm promoting to address the marginalized community, right? Or the way I'm trying to provide access to a certain type of healthcare to a group of individuals who haven't had it. Those things have the same effect on what it means for people to actually acknowledge how racism is a part of our public health communities. So I'm stressing here that the small scale sets the pattern for the whole system. And it's great that, we have the racism declaration that's available. We'll talk about some of the actions that people can do. But most importantly, if we disconnect our individual daily lives from the grand scheme of work that we're trying to do as public health professionals, we're ignoring how racism as a system works in our lives, right? And if we're saying that it doesn't matter because I'm not a part of those groups, I don't live near people of color. Like, if you have all of these reasons, that's the internalized part. Like, this system is that big that you've already internalized the ways in which you've been marginalized from people of color, and you've accepted it and said that this is the way it should be. So lastly, I just want to go a little bit over our session. So if you could go to the next slide. So our session's entitled Triple A for Creating Institutional Equity. And so we will be talking about 3 ideas: action, accountability, and allyship. And we have accomplices, right? And so we will spend time in that session really talking about individuals as influencers and leaders in their organization being able to actually create institutional equity. What does it look like? What actions can individuals take? What does it mean for, say, signing on to the racism declaration? What does that mean for our organization? What does it mean for us to create a particular policy that really speaks to racism, oppression, and continual marginalization of people of color? What does it mean for us to take a stance, like to put out a press release in favor of Black Lives Matter, or those are just examples. What does it mean for us to actually take these actions, and what kind of implications are we putting forth if we are taking those actions? Next is accountability. And accountability is, and thanks, Leanne, I'm actually going to talk about it. Accountability is talking about, once we put those actions out there, what does it mean for us to be held accountable for them? And as public health professionals, that means the general public should be able to come to any public health professional and say, hey, this declaration has been made by public health. what are you doing? What does it look like to actually be held accountable? And what does accountability look like and feel like if we're actually trying to, prevent racism and promote Black life in such a way? And so we're talking about accountability structures as peers working with each other who are trying to get this work done. We're trying to change the system internally because we're professionals and we share a space. And then what does it look like for us in the general sense as we're adults who are living in the world and we have young people that we birthed or that we are trying to teach, and how do we allow that accountability to exist? Next, we have allyship. And allyship, we'll talk a lot about the process to allyship. Similar to white privilege, has gotten to this point of where everyone just kind of feels good saying it. I'm an ally, see me as an ally, I'm an ally, and people just keep saying the word ally. But really talking about what does allyship actually mean? If I'm actually taking action and being held accountable, what does it look like to do allyship? And that this, again, like I said before, is a framework for us to think about equity, even beyond racism, even thinking about other systems of oppression as they work together. And then I also put accomplices here because I know that, especially as I look at the names in the room, some of us have been doing this work for a long time and have been bringing race to the forefront in very bold and challenging ways when it comes to public health. And so we're talking about allyship. That's about getting in the driver's seat. That's like saying, I'm gonna test drive this. I'm gonna start working around and promoting myself as an ally and asking what I need to do and getting more questions and really checking my self-awareness and identity. That's what allyship is. When we get to accomplices, the level of accountability is actually increased, and we're also talking about our work to change, right? Our work to change. Like accomplice is that I am putting myself on the front line to actually put racism to task in tangible ways in which my organization needs to change. When we get to accomplices, we're talking about individuals who are saying, this isn't just a great idea, this isn't just making me feel good, I'm not just learning about this, lives are at stake, and I'm trying to make a change here. So what do I need to do to make sure that this change happens? How can I use my proximity to whiteness or in other ways when we're talking about other systems as they intersect with racism? How can I intersect with the way that I've been able to be educated, or the way I hold class privilege, or the way I hold cisgender privilege? What can I do to actually enact a change and work on behalf of other people? Allyship is really mostly about what I'm going to do because of who I am and how I show up in the world. As someone who is educated, what does it look like for me to advocate for people who don't have a PhD after their name to be in these spaces? That's what allies do. I might advocate and say, we should ask this person, that person. We should make sure that other folks are at the table. The accomplices is actively working to say, I need to make sure that these other voices are here. That's it. I'm making sure that work happens. So understanding, I think Lillian made a good point there about both of these roles are definitely necessary when we're talking about undoing the system. And that we need to be in spaces prepared to do so. But I acknowledge the differences. And if this is new to me and I have not ever advocated for what does it mean to prevent racism in the work that I'm doing every day, I need to get into allyship so I understand what the role of the ally is and how that works. If I've been doing this for years and it's about how do I show up every day to really change the norms that dictate and support the systems of racism and the work that I do, I'm getting into accomplices and how do I change some of that work. So thank you, Lillian, for the question. Definitely open for any more follow-ups if there is. What does it mean to take up racism as an issue in public health, given it has a very symbiotic relationship with the state and has for centuries been an institution of reform at its core? I don't disagree that challenging racism means to directly challenge the power of the state. It really is that. I mean, again, that's a whole nother workshop for us to have that conversation. And maybe if you wouldn't mind rewording your question so I can make sure I'm understanding it correctly. What I can say is that I know in our public health field, we are so connected to a lot of other systems of oppression that exist. And one of them that we don't like to talk about is the way our government system, the way our economic system, the way those are set up, and the way that public health then is a function of those two systems makes it very easy for public health professionals and organizations within that field to promote racism, because that's how it's been defined based on the work that you're doing. I think when you understand that those institutions have framed what public health is, to challenge that is really to bring in these issues of human dignity back to the core. So what does it mean to back up the lens on the whole system and say, where are we coming into play and why are we coming into play? And then zooming in to think specifically on which ways racism have come into play. One of the most useful things in response to that question that I have found is in really having people have a chance to look at language that is used, either through the policies, practices, or even just the colloquialisms of their organization. Checking that language and the ways that we use language to reinforce racist ideology can really be helpful. And that also becomes a part of understanding how your system promotes racism unintentionally. And just because it's unintentional does not make it not racist. That's one of our points too, that racism isn't about intentionality. Just because it was unintentional does not mean it wasn't racist. The system that we have right here is racism. We are a part of it. And actions really fulfill how that system works. And so when the action is being called racist, it's because it's a part of a racist system. And we can't back away from the way that we use that language, which I feel like has been a part of the institutional challenges that we've had, is that we don't want to use the word racist. And I know there's a lot of webinars and a lot of social justice media work on that about, what does it mean for us to say the words whiteness, anti-blackness, racism, and racist unapologetically without feeling like if we use some better language, some more palatable language, we'll put ourselves in a better position to actually address the issue. But actually we're doing the exact opposite. If we use the palatable language, we're really reinforcing the fact that that institution itself is racist, because we're trying to silence the fact that we can call it out for what it is. But thank you for that question. I hope I got to it, because that's the complexity of it, right? And as a revolutionary thinker, which a lot of people are who are doing this work, you probably go home at night and say this whole system is trash, like it all needs to go away. And that's not like invalid thought, but that doesn't really speak to the work that we get up to do every day, and the work that pays our bills, and the work that continues to make change in individual lives. We can't separate that. Oh, awesome. So what are some ways that we can prepare to engage with the session and conversations about racism at the summit? Great question. So the first thing is, as we think about actions, accountabilities, and allyship, is being able to think about commitments that you as an individual would like to make when it comes to addressing racism. So we're talking about the prevention of racism as a pervasive system that marginalizes people from their fullest sense of human dignity. We're talking about being able to think about the influence that you have at your organization, being able to understand how that system works in your organization. What personal commitment do you think that you can make, which is really important, because we'll get into actions that really support those commitments in the learning space, which is really, really important. And it's not to deny that small commitments, deny small commitments in any way. Small commitments are important. Large commitments are important. They mean nothing unless we have action and accountability that goes with them. So it would be really great to think about commitments that you want to be a part of, commitments that you think your organization should be thinking about before preparing for the space. Another thing is, there are some readings that would definitely be helpful to look at. I think that we're sending out a reminder afterwards with a link of the recorded webinar, and I can include some of those. I did mention Emergent Strategy by Adrienne Marie Brown, which I think is really helpful as you see yourself as an individual change agent at your organization. But also thinking about the parts of racism that we've allowed to persist in our organization. So what does it mean for us to learn more about power and how power works? What does it mean for us to talk about the development of our own preconceptions? What does it mean for us to talk about privileges and pathologies? So I can send a couple things out with the recording that might be helpful to look at as we prepare at the summit. And one of the things, just so I can mention here, as we are preparing for the summit, is that you'll walk away with thinking about your action plan for enacting some serious change around the prevention of racism and the promotion of Black life in your organization. We put together sort of like a real quick leadership challenge. And leadership challenge isn't just for organizational leaders, it's just thinking about individuals and their capacity to be leaders around preventing racism, which will be a part of that space, enacting the leadership challenge. Yeah, so Lily Ann's question, can we talk about the racialization of power and tears as weapons in preparation for the summit? This is probably more longer, a conversation for a longer time than we have. But when we're thinking about, again, we're just going back and kind of reiterating some of the ideas that we've talked about in this system of racism. There's individual actions that play into my proximity to whiteness that enact racism. They are racist actions. And they are actions that make sure to marginalize people because of their proximity to Blackness that, again, are racist actions. And some of those actions are about how people show up in the world. There have been times when people have talked about the way I laugh, the volume of the voice, the way my hair is, the color of my lipstick, the color of my skin, the way I dress, basically trying to demonstrate that my proximity to Blackness was problematic and therefore defining how I should show up in the space or preventing me from being fully recognized in the space. I think on the other side is that people enact whiteness with actions too, right? And so proximity to whiteness isn't about how pale I am. It's about thinking about the history and the development of racism and racist attitudes and racist actions. Proximity to whiteness, again, is a malleable, forever changing thing that's constantly, subsumed other identities and subsumed other ways of working within it. Also, systems of oppression work in tandem with each other. And so gender, sexuality, queer identities, all of that fit into how people are interpreting whiteness. And so what Lily Ann is mentioning here, is using tears as weapons, is that the fragility, the idea of the fragile white female has historically been promoted as kind of something that should be protected at all costs, the most valuable of identities that exist. And when that idea is enacted, it makes the big Black brute a threat and the white female somebody to protect. And so that's probably won't be our intention, but again, intentions don't matter when we're talking about the system of racism that has really allowed us to enact racist actions. So I put that out there as an ability to see proximity to whiteness, including things that conjure up ideas of being white, doing white things, in opposition to being Black and being doing Black things. And so those things are two spectrums that are really deeply rooted in how we understand racism and the practice of racism. So we racialize people based on how they show up in the world, and that's really inhumane because there are a lot of individuals have responses to humiliation or emotional responses that's just a part of how they are as human beings. But because of the way we racialize attitudes and actions, when one person does it, it becomes fragile and something to protect. When another person does it, it becomes dangerous and something to control. And that has been kind of the spectrum of how whiteness and Blackness have dictated actions and attitudes in our racist spaces. That was a really good question. Thank you so much for these questions. These have been really good. I am so excited to be a part of the Healthiest State Summit and really bringing these ideas of race and racism to the forefront so that we can talk critically about how it's defining our work, so we can think about our actions, so we can be unashamed of the fact that racism is dictating how we work. And as long as we stand back and say we don't want to talk about it because it's scary. We don't want to talk about it because it makes me feel bad, or we don't want to talk about it because if I think about it, it's going to make me feel icky inside. Like, as long as we hold those attitudes about racism, we won't be able to change anything as a field. We have to build up our capacity to talk about the system of racism, what it does to individuals, and how it prevents us from having healthy outcomes in the communities that we work. We have to bring it to the forefront. So excited that you all could be a part of this. I'm thankful for all of the questions. Again, you can definitely reach out to Ubuntu Research and Evaluation to engage further. You can find us on Facebook, Twitter, or Instagram. We would love to take some questions, and we work with organizations across the state and across the U.S. actually, in talking about race, racism, equity, justice, and liberation in their organizations, the intersections between different systems of oppression, and how we have to be different if we want anything different to happen in our communities. Like, we have to do things differently. Because as long as these systems continue to be persistent and pervasive into how we work, and as long as we don't talk about them, they don't become an issue, we'll allow them to persist, and our work really becomes useless. It becomes useless unless we actually center the fact that these systems of oppression are really dictating how we work. So appreciative of these questions. They're really good. So I hope to talk more with individuals about this. A Black woman PhD. You can also find me on Facebook for Monique at Monique Liston. I'm happy to engage and talk further about this. Again, thank you for everyone's attendance and attention. I hope today's session was informative and really puts you in a position to join us at the Healthiest State Summit later this month.
Thank you so much, Monique. This is Paula. I'll chime in just to wrap us up. As you said, we will certainly be sharing the recording to get folks into the space to be at the summit. We've also asked all registrants to take a couple of self-assessments at their sort of discretion to really encourage folks to come to the space with a level of intention. We're really excited to create a statewide platform to have these critical conversations and also to build bridges for the shared action. I think the action and the accountability pieces are as important as the allyship work. So really looking forward to understanding how we are engaging in these conversations together, holding each other accountable, and also building strong, durable relationships for our continued work ahead of us. In addition, referencing the commitments, like I said earlier on the call, and we have several of the folks involved in this, we will be sharing the web-based version of what the Wisconsin Public Health Association Racial Equity Work Group created, the Racism Declaration Sign-On. So we will be launching that with the summit, and all registrants will get more information on how they can sign on to commit to engaging in anti-racism work at the individual level and also at organizational levels. As well as at the summit, there will be opportunities for folks to engage in any of the other health equity priorities that we shared earlier in the call, and I'll span back to those priorities, but there will be opportunity for folks to really dive in to engaging not just in learning, which is incredibly important in capacity building, but also to engage in shared work around these 6 priorities, and we will refresh these priorities next fall at the next agenda setting meeting in 2019. With that, I'm going to close out the recording, and again, thank everyone for joining us today, and thanks certainly to Dr. Liston for sharing her wisdom and preparing us for the conversation in September. Thanks, everyone.